Good afternoon, everybody, and welcome. Good afternoon, brothers and sisters, and welcome to our Facebook Live event today. I saw that I was talking, but no one could hear me, so I'm going to start over. Today, we will be educating one another and sharing important facts about the COVID vaccine. My name is Kim Yvonne. I'm a proud Executive Vice President of SEIU Local 2015. And I'm joined by my brother, fellow EVP, Arnulfo de la Cruz, as well as we will be joined by Dr. Tomas Diaz, who is a physician at the Department of Emergency Medicine at University of California, San Francisco, and a fellow caregiver and member leader, Elena Brooks, who is an IHSS provider from Palmdale. Look, we know the impact of the COVID pandemic, and especially this vaccination rollout, is weighing heavily on the minds of our members, caregivers, and frontline workers like yourself who take care of our most vulnerable in our communities. And the reality is we've had to deal with a lack of federal leadership and a lack of fact-based information from the start of this pandemic, which has sort of tainted a lot of folks' view on what a trusted source is on the vaccination and its related information. And we understand that there's some real concerns, and some are generated by misinformation that's been spread about the vaccine, and for others, there's been some deep-seated historical distrust in medical institutions and in the history of our past of government experimentations on Black and Brown communities. And we also have a mistrust of employers being a trusted voice for our members who work in skilled nursing facilities. Their experience has been that there's been a lack of transparency from their employers about the COVID virus, as well as a lack of investing in health and safety for them as it relates to personal protective equipment. So they want to hear from trusted voices around the questions they have about the vaccine. And look, even though the planning and coordination has not been as efficient and effective from the state and counties, we know that now we have the full force of our federal government in helping to get more vaccinations produced and into our hands, down into our communities. And I'd like to think we have the full force of the members of SEIU 2015, because we are a force of nature, and when we put our minds to something, everything is possible. And so this Facebook Live event is being held as part of our We Can Do It campaign, which we launched last week, that seeks to really defeat this virus through promoting mass vaccination and rebuilding our healthcare infrastructure in a way that never leaves us this vulnerable again. And we want to use our time together on this event to do two things. First, we're going to create the opportunity for you to hear from trusted voices, like our medical expert, Dr. Diaz, who can answer questions related to the vaccine, and the trusted voice of a fellow care provider, Elena Brooks, who can talk about why getting the vaccine was important to her. And then secondly, we're going to share more about the We Can Do It campaign and how you can help in that effort. So, Arnulfo, to get us started, how are you thinking about the rollout right now?
Great, thanks, Kim. And I see in the comments that have already been left that folks are really appreciative of the information you've already shared. And I'm seeing in some of the comments, I know from Miss Brenda in Alameda, who's already gotten her second round, that the experience that our folks have had with accessing the vaccine has been very different depending on maybe where you live, right? And as part of that, I just want to revisit, as SEIU 2015, we said, look, in preparation for the rollout of this vaccine, it's really important that we have principles, right? SEIU 2015 members are essential. Our members are on the front lines in the fight against the pandemic. And then we were also in the midst of having to confront three different crises: the pandemic, the economic collapse, and then also ongoing racial injustice. So that was our call to demand that we do more and demand that corporations and elected officials not just praise us as essential, but also respect us, protect us, and pay us. So as it relates to the vaccine, I'd be curious from all of you, what has your experience been from the vaccine? Go ahead and leave it in the comments. We can share with each other. As I've said, I've heard very different experiences that folks have had depending on what county you're in. But first, we said the vaccine is a critical tool to protect our families, ourselves, and our communities as we fight to put an end to this virus. And that also we encourage SEIU 2015 members where they can, that they take the vaccine. We also have been very clear that the vaccine needs to be equitable and transparent. and that the vaccine needs to target and prioritize communities that have been most impacted by COVID. We have lost too many people to this virus. We have to do a better job in terms of how it's rolling out. The idea that you can go to one location in the county and that thousands or hundreds of thousands of people would access the vaccine in just one location, we know that doesn't work. So the rollout has to come to us. The vaccine needs to come to our communities and target those areas where the impact has been the greatest. Also, we said that the vaccine needs to be provided free of charge, and that if you have to take the vaccine, that you should be paid time off to go do that. Also, SEIU 2015 family, we've said the vaccine can't just be a substitute for worker safety and infection control. We have to continue to demand that we have sustainable PPE, right? Personal protective equipment. And so a lot of these principles are at play right now, right? We have to do more. If you feel like the rollout in your county or in your community is not sufficient, I invite you to pick up the phone, call a board of supervisor, call your representative, because there's so much more that we can do. We know that the supply has been a big issue, but again, I'm confident, as Kim said, that we can do it if we all lift up our voices. That's the strength of our union, that we come together and do more to ensure that the rollout of this vaccine is successful. So I'm going to go ahead and go back to you, Kim.
Great, thanks, Arnulfo. And I just want to recognize a couple of comments as we're getting started. If you want to know your site for your vaccination location, California, please go onto our website, www.seiu2015.org. There's a COVID-19 page that also has the links to all of the counties and where you can register and find your site. I want to lift up Coralia Rodriguez, members that don't have cars. It's very hard. We hear you, sister. That's why we're doing this campaign. It's about equity and getting to the vaccinations down into the communities where people don't have the luxury of getting in their cars and driving an hour to get the vaccine. So I want to just lift that up and appreciate those comments. And, and we know real obstacles exist, right? Last week, the CDC reported that 63% of nursing home workers didn't take the vaccine when they were first offered it. So we got to create trust in the vaccine, even though, yes, Michelle Borges, it is a choice. We believe that folks can make a good choice, an informed choice, once they know the facts about the vaccine and the tools available to learn more about it. So that's why it's so important that you all are part of helping to encourage, support, and normalize mass vaccination, offer fact-based information on why and how to get vaccinated, give voice and support and prioritization to communities like Aurelia lifted up in the chat, and be a trusted voice that helps combat the skepticism and reservations that folks have about it based on misinformation and past experiences. And like Arnulfo said at the end, foster and demand accountability and transparency from employers, corporations, and government to ensure that there's a fair distribution of this vaccine and all the efforts related to the pandemic. So let's get started, because we're here to get educated and to share and educate each other. So I want to introduce to you Dr. Tomas Diaz. He, like I said, is a physician in the Department of Emergency at the University of California, San Francisco. His scholarship and community work emphasizes humility, equity, and justice in medicine. He is originally from New York City and was among a group of volunteer medical professionals who traveled to New York to help care for patients during the peak of this pandemic back in April of last year. Dr. Diaz, thank you so much for spending your time here with us on such an important topic. I want to let our viewers know that you'll be covering some key questions and concerns that have been coming up from caregivers and other workers in your initial presentation. And we also encourage folks to put questions in the chat that we'll be monitoring, Arnulfo and I, while you're doing the presentation, to see if there are any new questions to field to you. So, sound like a plan?
Sounds like a plan. Thank you for having me, everyone. Hi, my name's Tomas. As mentioned, I'm an emergency physician in San Francisco at the University of California in San Francisco. And just to get started, I'd like to say that I am here to provide information. I am not here to make a decision for you. What I'd like to do during this session is provide you with the most up-to-date evidence-based information, answer your questions so that you can make the best decision for yourself, your family, and your community. So we'll get started with just some slides to cover some basic information just to get everyone on the same page. So if we can move to the next slide. So just to get started, there are 2 vaccines that are currently approved in the United States. Those are the Moderna and the Pfizer vaccines. You may have heard of others, such as the AstraZeneca or the Johnson & Johnson. Those are not currently approved in the United States, though it is possible that they may be approved, especially the Johnson & Johnson, in the near future. So the Moderna and Pfizer vaccines are made very similar to each other, and I'll explain that in a bit, and they're both highly effective. So for the Pfizer vaccine, both of them are 2-shot vaccines, and you'll get your first shot. You'll wait at least 3 weeks or 21 days before you get your second shot. And then the Moderna vaccine, similarly, is 2 shots, but you'll need to wait at least 4 weeks or 28 days. And the difference in the refrigeration has implications for the ability to get the vaccine to places that maybe lack the special equipment needed to store it. So right now, the Moderna vaccine is a little bit more transportable. So in terms of how the vaccine works, so you can see on the left in this little picture, the coronavirus. And what scientists incredibly have done is take a little segment of code, that little red part, and make it in the lab. And they have surrounded it in a layer of fat and added some sugars and salt into that as well. And that is what is injected into your muscle. The fat layer helps the muscle cell pick it up. And then when your muscle cell picks it up, reads that little bit of code and prints it out, it says, you know, this is not supposed to be here. This is not part of my body. And it presents it to the system, which then builds antibodies to build a defense. And then how well does this vaccine work? So this is information from the Pfizer vaccine trial. In terms of the number of people that were included, over 42,000 people were included in this trial, and about half of them got the vaccine and half got a placebo. So they got a shot, but it did not include the vaccine. Among the people who got the vaccine, there were only 8 cases of folks with COVID symptoms versus 162 cases in the group that got the placebo. So that works out to 95% effective, which is very good. And just for some context, the flu shot that we're used to getting every year is probably only about 60 or 70% effective on a good year. And in terms of side effects, many of you, it looks like in the chat, have been experiencing some of these, the most common being arm soreness or redness at the injection site. And that's something that can and will pass. But other symptoms that folks are describing are fatigue, headache, body aches, chills. And these are particularly common after the second dose of the vaccine because after the first dose, you build some response, but after the second dose, you build an even stronger response, which is going to protect you long term. And so those symptoms are signs that your immune system is working. There are cases of allergic reactions, which is why after you get the vaccine, you'll probably be asked to wait for about 15 minutes just to be observed. If you do have an allergic reaction, we know how to treat those. There have not been any serious complications or deaths related to allergic reactions. Most people, from the side effects they experience, they're able to take some Tylenol and continue with their day and daily activities. And these are the things we do know. So we do know that the vaccine is safe and effective for older folks. It's safe for both men and women and across genders. It's safe for all adults. The trials with children are still ongoing. And folks from all races and all ethnicities were included in the trial. We also know that it's safe for people who have chronic diseases, things like high blood pressure, high cholesterol, diabetes. I saw in the chat, if you have a history of stroke, it's okay to get the vaccine. It should not interfere with either those illnesses or the medications that you might be taking for those illnesses. And then, as mentioned, the side effects are particularly common after the second dose. So we do know that. Another thing that is important to recognize is that the vaccine is free. The federal government has agreed to pay for these the initial rollout of the vaccine. One important thing to note, though, is that ultimately, if we do need booster shots related to the variants that are out there, and I'm happy to answer any questions about the specific variants that we've been hearing about, the federal government has not agreed, as of yet at least, to pay for any of those booster shots. So that time will tell regarding that, but at least these first initial doses will be free for you all. Things that we don't know yet, because it's important to recognize that this is all very new. So we don't know that if after you get the vaccine, if you can still get an infection but not have any symptoms and potentially pass the infection to somebody who has not been vaccinated and they will experience symptoms. Though information coming out seems that it actually is doing a good job of reducing the transmission between different people, the vaccine that is. Additionally, we don't know for sure how the safety might look in pregnancy. Right now, the American College of Obstetricians and Gynecologists, the national organization, does recommend that the vaccine is offered and taken by people who are pregnant and breastfeeding. But if you have specific questions, I would recommend talking to your OBGYN. The vaccine trial is underway for children, and I think it will be approved for children in the near future. And the other thing we don't know is how long protection will last. You know, we're hopeful that this is something that will last years, but the truth is we don't know. And so we don't know if we'll need booster shots related to the new variants or just because the immunity eventually goes down over time. So in terms of weighing the decision for yourself, in terms of is the vaccine right for me, what I would recommend that everybody does is sort of weigh in their minds, what are the risks of getting the vaccine for me and my family versus what are the risks of getting COVID for me and my family? Because as we know, about 470,000 people have died of COVID, and lots more have had it and are experiencing, long-term consequences of it. So getting COVID is certainly a big risk as well. So making that decision should be balancing those two questions. Some things that we know right now are not going to change. After you get the vaccine, you will still be asked to wear a mask, to wash hands, to stay home as much as possible, and physically distance 6 feet. And that's because, as I mentioned, right now we don't know if one might still be able to spread the virus despite not having symptoms of it because you were vaccinated. So I think that will change eventually, but for now, these will remain the recommendations. And then just to tell you a little bit about why I chose to get the vaccine. So I was actually the fourth person in my hospital system to get the vaccine. And, you know, as an emergency medicine provider, I not only wanted to protect myself, but I wanted to protect my patients. I'm fortunate in the sense that I do not have any medical conditions, but I'm taking care of people every day who have weakened immune systems, who have chronic diseases, and it was important to me to not spread the virus to them potentially. Beyond that, there's thinking about my partner who I live with, as well as the rest of my family who are back on the East Coast. This is actually a photo of my grandmother on the right. She is 89 years old, and she just got her second dose of the vaccine last week. And I'm very excited because I'm looking forward to sort of getting beyond this and being able to build community again in person. So I'm hopeful that the vaccine is one of the tools that we can use to get there. And with that, I'm happy to answer any questions that have been popping up in the chat.
Great, so I can see a few. So I see Patty Rios is asking, is it true that if you've already had the virus, you just need one shot?
So that is not true. So if you have already had the virus, we do recommend the vaccine because we do already know folks who have gotten infected for a second time. And the hope is that the vaccine immunity will last longer than the immunity with natural infection. So we recommend that you get the vaccine, and that vaccine will still be 2 doses. I will say the Johnson & Johnson vaccine is a one-shot vaccine, but like I mentioned, it's not yet approved in the United States. So as things stand right now, any vaccine you will get that's currently approved will be 2 shots.
Great. There's one question that was lifted up for me earlier in the chat. It was from Rachel asking, is it safe for someone who has pre-existing kidney or liver issues to take the vaccine? And I see there's some other questions in the chat about, like, I have a specific condition. Is it okay for me to get the vaccine? I was wondering what you would respond, Dr. Tomas.
Yeah, absolutely. So there is no illness that should prevent anyone from getting the vaccine. So if you have a history of, like I mentioned, high blood pressure, HIV, it's still okay, and the vaccine will be effective. What I will say is that, and that goes also just to specifically address it to liver disease, heart disease, kidney disease, the vaccine is safe to take. For people who have weakened immune systems, either related to cancer and chemotherapy or to medications for a chronic illness, say like lupus, where they're taking medications that weaken their immune system, the vaccine may be slightly less effective because those medications that they're on or the chemotherapy weaken the immune system and they don't build as robust or as strong of a response and build as many antibodies. Being said, I would say personally that some response is better than no response, particularly because these same patients with weakened immune systems are the folks that our emergency department coming in very sick from COVID. So my recommendation would be, it's definitely safe if you have these chronic illnesses. And even though you might not have as strong of protection, I would still recommend some protection over no protection.
Great. Arnulfo, do you see any questions? I have a couple more, but I'm going to see.
Yeah, I saw one that said if you've already had COVID, how long should you wait before you get the shot?
That's a fantastic question. So if you currently have COVID or recently had COVID, as long as you are through your isolation period, which is usually 10 days from symptom onset, as well as 24 hours without fever. So as long as you meet your criteria and your doctor or provider has said that you no longer need to isolate, you are okay and clear to get the vaccine. The one caveat to that is if you were very sick with COVID and you were in the hospital and got IV antibodies like remdesivir to protect and fight against the virus, then you need to wait 90 days. So that special population needs to wait longer, but for most other people, it'll just be 10 days from onset of the symptoms.
That's great, doctor. And I actually think that was a separate question, so you just addressed both questions. The last question I thought I saw, which I felt like you addressed in your first slide, but let's just make sure that we address it in case it wasn't, is someone has already received their first vaccine. They are now scheduled exactly 2 weeks after their first one to receive their second. Is that too soon? That's the concern of this provider.
Yes. So what I would say is for the Pfizer vaccine, you need at least 3 weeks, and Moderna at least 4 weeks. So you should not be scheduled earlier. So 2 weeks does not seem like long enough time. And that's because we want to give the body enough time to make the appropriate response so that you're as protected as possible. If you did it early, you probably would get some protection, but the way it was studied, and so the way that it's being rolled out is based on those initial protocols of 3 weeks for Pfizer and 4 weeks for Moderna. If it's a little longer, that's okay. Earlier should not be the case.
And then I saw one more question. I'm going to create it into 2 questions because I saw it in different ways. So one was like, wow, like my arm still hurts. What's up with that? How long? And then like sort of what's the length of time you should expect to experience any side effects that is reasonable?
Yeah, so in terms of the arm soreness, I would say for most people, it's usually only lasting a couple of days, a few days. If you're still having arm pain, and especially if you still have a rash and it's red and if it's warm, I would recommend seeing your physician or your provider because you can get things like with any needle or any break of the skin, you can get a skin infection. So it's probably worth just checking out if it's lasting that long. Because usually, and even with the second dose where we're seeing stronger immune responses and more symptoms, usually for people, it's only lasting 1 to 2 days, although I do know of people who have had symptoms for maybe 3 or 4 days. But like I said, most people, 24 or 48 hours, and that's it.
Great. And so one last question is, so Peggy Roden has a son who has Down syndrome and is scheduled to have major surgery at UCSF in March. He's getting his second shot March 13. Is it okay to have the surgery in March after his second shot?
So the answer that I would say is yes, it should be safe. But I do think that's also important to talk to his specific doctors about who know him best. And I would say that generally for everyone, if you have a provider that you've been seeing for a long time and you have specific questions based on your specific medical history, I can say that really vaccine is safe for most everyone. But if you have any specific questions about your medical history, definitely do reach out to the providers who know you best. But in your case, it does sound like he should be safe to get the vaccine and still undergo surgery.
Great. Well, thank you so much, Dr. Diaz. You've answered so many questions. It was really super helpful. I hope everybody on the Facebook Live has gotten most of their questions answered, if not good advice about how to follow up with very specific medical related issues. So just want to appreciate you for being on and helping to educate us all about it.
Yeah, thank you for having me. And like I said, I'm just here. I want to provide the information so that everybody can make the best decision for themselves.
Great. And we may call you back.
Dr. Diaz, I was thinking the next step may be to give everyone your cell phone number, but just to let you know, we've had today over 100 messages just in the last several minutes. So we really appreciate you, a young doctor, a person of color. Congratulations that your grandmother, 89, has gotten her second. You're leading in your family and your community, and we really, really appreciate it. And I think so many of the questions that were asked today were answered. So thank you so much for joining us. And we wouldn't be having fun if we didn't have an SEIU 2015 member also with us in this space. So it's my real pleasure to also introduce our executive board member and member leader, Elena Brooks, who's going to just share her experience with the vaccine. Elena, welcome, sister.
Hi, brother. Thank you. Hi, sisters and brothers across California and beyond. So a little bit about me. I've been a full-time care provider for IHSS for over 10 years. And just shy of a year ago, on February 22nd of last year, my person that I provide care to, my brother, he didn't wake up that morning. And we didn't quite, there was no explanation. COVID wasn't on the map then. He had just passed away in his sleep. And so as we began to get knowledge about COVID and, protect ourselves, practicing social distancing, the other person that I provided care to for a number of years, he passed away on July 1st. And that took a lot out of me. And the mental gymnastics and playing back what had happened within 5 months and preceding the death of my brother, I was very sick. I had what I thought was the flu, pneumonia. This must be the flu thing. And I had never felt that way in my life. And so understanding and getting knowledge about COVID, I went for an antibody test. At that point, they said if I had it, it wouldn't show up. So I didn't get that answer. I don't know if I had COVID, if I passed COVID to either of my persons, because they were both diagnosed with pneumonia and not COVID. But it just left me in a state where I didn't know what to do. I thank God that the vaccine became available. I received my first dose of the Moderna vaccine on January 6th. And I received my second dose of the Moderna vaccine on February 5th. And it was only after receiving my second dose of the vaccine that I was able to mentally and physically return to work. I went back to work caring for a new person in my community this week on Monday. And I think it was exactly 7 days after my second dose of Moderna. And I will say this, the one certain thing that I could offer to my new person who's been diagnosed with ALS is that I have been vaccinated. And the relief and appreciation of my person and their family, I tell you, that's what we need. I don't know what happened back last year with the persons that I was providing care to, but I know that I did everything I could for them while they were here. And I know right now I'm continuing to work, and I know that I am not exposing this person who's already vulnerable to a virus that I may contract, at the Costco. So for anyone, for particularly healthcare workers or anyone that's afraid or reluctant to get the vaccine, I would ask you to ask yourself, have you ever had a vaccine? Because most of us here in the United States have had vaccines. And ask yourself, have you ever had a bad reaction to a vaccine? Because most of us have not had a bad reaction. COVID is real, and it's taken lives, and particularly for healthcare workers, we do no harm. So if you can get a vaccine, the peace of mind of knowing that you are not harming anyone that you are coming into contact with will help you avoid. I had many sleepless nights just wondering what if, and that's all in vain, because there's nothing I could do about the past. But I know today that I am not going to expose anyone to that. I'm doing everything that I can to keep my persons healthy. So I do recommend you get the vaccine. For me, what happens afterwards, I've had, what do you call those? Antibiotic shots before. You know, you get bit by a dog or something happens, you step on a nail, you get an antibiotic shot. It's a little sore for a couple days, but that's it. So that's the only reaction that I had to the vaccine, just a little sore, just the exact reaction of an antibiotic. And it's a good thing. I'm happy to return to work. Before I could get on the registry, I was offered a job, another IHSS job, who I prefer working for. And I'm really happy about it. And like I said, the family that I work for, their family, they have not had the vaccine, but they are really, really happy that I have had the vaccine. So for you healthcare workers out there, you know, that's just a badge that you can carry, and people take comfort in knowing that you're vaccinated.
That's great, Elena. And also, it just feels like you now also have an opportunity to educate your care recipient about like the experience of getting a vaccine, you know, giving them the education and confidence to get it, you know, in their community. So that's thank you so much for that story. It's very helpful. And you're getting a lot of like, yay, Elena, thank you, like in the chat box. So people are appreciating you sharing that.
Okay, thanks, guys.
Thanks.
Yeah, thank you so much, Elena, for your courage and your strength. I think you are, I imagine a lot of people listening right now can really relate to the pain and the loss that you've had, but also how strong a person you are. And people are saying blessings your way. Congratulations, as Kim said. I don't know if you can see all the comments, but we're so appreciative of your leadership and your courage and your strength in sharing your story. And, you know, it's a good segue. We, as you all know, we launched the We Can Do It campaign, right? We, working with local, state, and national partners, providing fact-based information, as we just heard from Dr. Diaz, that are delivered by trusted voices. The We Can Do It campaign is really about instilling and building trust for the vaccine in our communities. And we know it should be everyone's choice, right? This is your own choice. You know what's best. But we want to make sure that as the vaccine continues to roll out, that we have to address that it be targeted in communities, especially Black and Brown communities, which have been the most impacted by the virus. So as an organization of over 400,000 home care and nursing home workers, predominantly women of color, that were represented by SEIU 2015, we wanted to look at history as to where we could get inspiration. And the art that we've used for this campaign, which I think some of you have seen, is Carmen the Caregiver. And what Carmen the Caregiver does is it pays homage to Rosie the Riveter, which was the image that was used during World War II that helped to inspire and symbolize American women who went to work in the factories and the shipyards, who were replacing the men who had joined the military. And so today we're revealing our latest artwork for the We Can Do It campaign, which you'll see on the screen. And we also know that this is the beginning, right? There you see, there you have it there. Who's that? It looks like it's the president with his Band-Aid after getting his shot, President Biden himself, as part of the We Can Do It. And sure enough, our very own here from California, Vice President Kamala Harris. Again, we're going to use these images as a way to build confidence and continue to spread the word. And I got to say, Kim, the other thing that's really an amazing testament to the leadership of our members is so many of you have already accessed the vaccine. I think that's what really strikes me, is that we're just seeing so many people here who have already been able to access the vaccine. And also for those of you who have not, again, the SEIU website, SEIU2015.org, has the most up-to-date information on how you can access the vaccine in your specific county. So again, we can do it. Si se puede. All of us come together and lift up our voices to do all we can to beat back this pandemic. I'm going to now turn it back to Sister Kim.
Yeah, so let's talk about what we can do together as part of the We Can Do It campaign. And I want to lift up there, Rosa Villegas, along with a couple of other folks, like lifted up concerns about, oh, how do we get the vaccination, make sure it's to the folks that we take care of that have disabilities. So here's what we can do, because that's a great question. We need to make sure this vaccine is a priority for our caregivers and our consumers in our policy plans, both locally and nationally. So we have to prioritize the vaccine, how we get it, where it goes, that we have enough in our local and state budgets, and put together plans that place a real focus in the months leading up to the June state budget on equitable and efficient vaccine rollout. So Rosa, to your point, equitable, we have to make sure that this vaccine gets to folks who don't have the physical mobility to get it themselves. We have to train workers across the state to meet the needs for the COVID vaccine and beyond. And right now, you can take action by filling out the We Can Do It pledge. And you can find that on our website at www.seiu2015.org/We Can Do It. And that's going to connect you with other ways to take an active role in making sure that we're prioritizing the vaccine and an equitable rollout in our state budget. And so that's what we can do on the state side right now and locally. And as Arnulfo said, call your board of supervisor, call your legislator about your concerns to get this vaccine down into the communities that need it the most and to our care recipients. Arnulfo, what's the other piece that folks can do to be part of the We Can Do It campaign?
Yeah, and thanks, Kim. I feel like, the elephant in the room has been, look, there hasn't been enough supply. And we feel really confident, given the shift in leadership at the White House, that much more availability of the vaccine is on its way. At the same time, we want to do all we can to lift up our voices, because we're also talking about a national stimulus, right? The vaccine has to remain a priority. We have to ship it to California, states and counties, because it's been really inconsistent throughout this entire rollout. And the federal government plays an incredibly important role. We saw the impact of 4 years with the lack of leadership at the White House. We cannot afford to have that happen again. And we're confident that more vaccines are on the way. Also, we know that the stimulus package needs to address the needs of our communities, right? We have to continue to provide more resources to California. And as Kim said, when we join together and take action, there's nothing that we can't accomplish. So again, sign up, make sure that you take the We Can Do It pledge on our website, SEIU2015.org/We Can Do It, and make a commitment to help keep your family and your community safe, right? We all need to do our piece to advance this. And we also know that the Biden Care Plan is also at play, which would inject billions of dollars in resources into long-term care across the country and in California. So having our collective powerful voice as SEIU 2015 is also really critical to making sure that we're able to pass the first care plan in our history that has a huge impact on long-term care. So with that said, we're not through yet, right? We want to push this legislation forward. In order to do that, every Friday, we're calling our legislators who represent us in Washington, D.C. They need to hear from you, right? So what you see up on the screen are the phone numbers. So this Friday and every Friday until we pass this plan, we're asking each of you to make sure that you commit to calling the numbers on the screen and let your representative know that this legislation is going to ensure that we have good home care, nursing home jobs in California, and that we're ensuring that our families are going to get the services that they need without facing financial consequences, right? So let's do this. Se puede, make sure that we make those calls. And I'm going to go ahead back to you, Sister Kim.
Great. So that concludes our Facebook Live event. We are so glad that you joined us. We hope that you got the information and education for you to be part of our efforts in the We Can Do It campaign. I look forward, as our NOFO does, to joining you every Friday, making calls to Congress to get that legislation. And look, although we have come a long way, we still have a road that we have to walk together to make sure that this vaccination rollout is equitable and efficient. And at the end of the day, we are part of healing our community here in California and nationally. So we look forward to working together with all of you, because sisters and brothers, we can do it. Good afternoon, good night. Talk to you soon.